OpenMRS has come a long way in 20 years. We started back in this beautiful country of Kenya back in 2004, and here we are 20 years later collaborating across hundreds of thousands of people in tens and hundreds of thousands of clinical settings to build a record system.
It's really just inspiring to be able to see all of these different people, all of the different ministries of health coming together and really wanting to understand each other's needs, align their visions.
I've come to learn from other people, particularly colleagues from Uganda, on how they're being able to implement their OpenMRS system. And it's really encouraging to learn that there's actually a bigger community that is sharing the same problems that we are with us.
We were able to hear from some of our squads, which have members from different organizations and members all over the world who are working together on features like billing, inventory management, lab systems integration, all things that become really important to work well together when it comes to having a robust system that can work back and forth with how governments are running universal health coverage.
We've had a very successful hackathon where we got many participants right from day one, and we've seen novel ideas, open innovations coming up.
As a developer, I've got to interact with different developers during the hackathon sessions, where we got to exchange insights and hack collectively to solve problems.
It has been an amazing experience for me personally, and even getting to engage with people from a diversity of communities from different parts of the world and knowing how they work and how they do things.
I've had the opportunity to interact with industry experts, yes, and during the first 2 days we had a hackathon, which I was able to make my first PR in the open source world of technology. So I was teamed up with a beautiful team who were working on the form builder, which was my first time working with OpenMRS, but the community ensured that I had the perfect foundation to be able to contribute, because I could openly ask questions to people and they would willingly answer them to me and guide me on it.
Just meeting people that I have been working with online, face-to-face, having great discussions, and on new faces as well. It's been a good experience.
And when those people come together, then they design the next phase of the evolution of OpenMRS. And that is why this conference is very valuable, and the fact that we're having in East Kenya is very, very exciting.
We also get to share experiences in our transformation journey in moving from a program-specific technology-focused organization to facility-wide focus.
It was my first time in Kenya, and even like looking at the Kenya EMR, getting the first-hand experience, going through this system, how they use it. So I feel so proud to be a part of this community, so because what I build here is using in the real world, and seeing that just made me so proud.
The pace of delivery we have had in the last 6 months, 9 months, because of the community of practice, and the level of scale we have achieved in the last 2 months alone, from 0 to 6 to 100 facilities running OpenMRS 3.0 is quite a big achievement in my view.
It is remarkable to see, for one of the first times ever, the speed of improvement that's happening thanks to this community collaboration. We were able to see clinicians using features that the community had developed only several weeks earlier, and we were able to see those making a very real, tangible impact in healthcare.
OpenMRS, for the first time, has really broken the bounds out of the HIV clinic, which has been the mainstay for many, many years, to be now facility-wide. This year, again, we've seen a lot of interest from many countries wanting to expand, or many countries saying that they would have liked to, but they didn't have the technology and support.
I'm exploring what is OpenMRS and all. I was exploring different healthcare systems which the government can use in countries like Sri Lanka, and I thought OpenMRS would be the best choice for such a thing. We are not generating enough data in terms of digitally analyzable stuff. So every year we are missing millions of data by not using a medical record system. And the countries like Sri Lanka, what I'm glad is that we have everything ready set up. and we have a very good model that we can come and see in Kenya and countries like Kenya who has been already implementing this one. And then it's like a kickstart. We just have to take this OpenMRS and work with the community people and utilize the fundings in the right way to have these basic things digitized in the e-health for the government.
The Kenya OMRS system is one of the best, right? They have done wonderful work in developing this system to cover a wide range of health services that they offer. Much of these services are actually what we have back home. So this system is going to be a good benchmark for us, going home, seeing what works, what doesn't.
One of the integrations that typically I know about is the cross-border that happens within the Kenya EMR. I mean, it's impressive to see that actually there is a possibility of moving patient data from within one EMR, then another EMR references it. And we kind of share that with Kenya EMR and Uganda EMR.
When you have a product that is not supported by a community of practice, then what you end up with is a small pool of software engineers who are able to support the solution. And in case they exit the scene or become unavailable to support, then you don't have a second line of support. What a community like this offers you is a second tier of support, a source of new talent.
My guess is that if you're an implementer, you're faced with the complexities and the challenges and the struggles of making systems work. And what I would say is you're not alone. The OpenMRS community is about a community of people that are trying to support each other as they're trying to build record systems together.
Obviously, not everybody is equipped to be a doctor, a nurse, but that doesn't mean we can't help the people of the world. That doesn't mean we can't help people who are in need, and OpenMRS is just the place to do that.
If you're passionate about better healthcare through better information, this is the community for you. We have such a broad set of skills. Of course, people often think about our other motto, which is write code, save lives, and they think of developers. And we welcome developers from every set in their skill journey. But we also have people like QA testers, business analysts, UX designers, translators, documenters. There are so many roles.
I see hope for how we can deliver reporting solutions, how we can go to scale, handle multi-tenancy, be prepared and start preparing for the cloud. We had great conversations around introducing AI or doing reporting.
So for me, this conference, it's opened up a lot of connections from this product management team to the terminology team to the development team. And the people like Palladium here, who is working with the government of Kenya, people I have introduced to.
I would like to send my warmest regards and appreciation to the Ministry of Health of Kenya, who invited us to come into their beautiful country, and to the hosts, the many organizations that help make the event possible, Palladium, Telesoft, Health IT, and the entire community that helped make this just a really incredible event.
As a parting shot, I think the digital transformation is what will leapfrog Africa into the best indicators that we have been dreaming of. We can have several years crushed into 1 year and be able to do a lot of things without having to go through the whole process. The digital ecosystem can make experience of an old person of 50 years be translated into somebody with 1 year experience through the platform.